everybody. Today is one of our very, very special and favorite holidays here at the system. It is Nurses Day. So we're going to meet a few nurses and patient navigators who are helping us throughout this COVID pandemic. But first, we're going to kick it to Lee today for the stats.
And the stats are, today we had 0 positive COVID patients. And I think that God gave us that for Nurses Day. We're very happy that we were at 0, so we're pretty excited. Hopefully we'll have another couple of days with 0, but on Nurses Day of all days to have a 0. And so today we're going to talk to you guys a little bit about this thing we call contact tracing. And we have several nurses and people that have volunteered for this. And again, Nurses Day, we have nurses that became epidemiologists / contact tracers / navigators / nurses. They did all of that. And to tell us a little bit about that is a person who helped lead the program, Heather Rowley, who's a nurse herself, a nurse leader, in fact, for us. If you would, Heather, tell them a little bit about the project, what we did.
Sure. So when we started with all of this COVID stuff, for the first couple of weeks, we were like, don't let anybody fall through the cracks, right? And we talked about that for a couple of weeks, and then we finally figured out we needed to contact trace. None of us are public health nurses, but our infection prevention friends said you need to contact trace. You need to contact trace. We're like, what is that? So we taught ourselves, or they helped teach us. And
before it was cool, before it was even on CNN, everybody was talking about, now everybody's talking about it. We were doing this 7 or so weeks ago.
7 weeks ago.
We put together the team. We put together the team, and we started doing it.
There were probably, I'm going to say, 8 to 10 contact tracers when we first started, because we started behind the 8 ball, right? Because we didn't start for the first couple of weeks. So we contacted each one of those positives and started that process. And we're going to talk to you about the process. We've been able to cut down our navigators or contact tracers just because our positives have gone down, thank goodness. But it's a really important thing to do.
And I've seen all the spreadsheets and all the information you guys have put together and all the dots that have been connected. It's been amazing. And I think that Sarah's going to introduce us to some of the contact tracers.
Indeed. So with us today, we have Stephanie and Shanna. They stepped up to the challenge from their normal, regular roles to go out and find our positive patients and make sure that they were connected with the right resources and the right care that they needed. So tell us a little bit about, what is your normal role here at the system?
I'm a nurse case manager in the patient resource department.
So what does that entail usually?
Pretty much making sure what all the patient's needs are at discharge. And some in the hospital, but mostly at discharge. We just make sure our patients are taken care of and whatever they need.
So it didn't seem like it was too far from where you came from. So why did you step up to do this?
Well, my director, Margie Dare, she spoke with me about it. She thought I'd be a good fit because I have experience in patient navigating.
Awesome. So Shanna, you usually work in an outpatient setting kind of the same way, right?
Yeah, so I work at the Neuroscience Center with Dr. Karcher and Dr. Evans, and kind of the same thing with Stephanie. It's a lot of managing, patients. They call in and if they need something, they need to get in for appointments, different things like that, and helping them kind of, navigate through whatever their disease process is. But also my boss as well came to me and said, hey, we have this opportunity. I think you'd be a good fit, and so here I am.
Well, tell us a little bit about the process that you actually got. So normally you're in the neuroscience division, but back to your nursing roots and learning with Heather everything we needed to do in this process. Tell us a little bit about the process you go through when you do this.
Okay. So when patients are tested for COVID-19, they are, if they are positive, then one of our clinicians, a nurse practitioner, a PA, or a doctor will contact the patient, let them know that they have been positive, and then a patient will be assigned to one of the navigators. We then reach out to the patient, make contact with them, let them know what we're doing. We have a questionnaire that covers everything from where they live to their comorbidities or what health concerns they have to what their symptoms are, who they live with, who they've been around, where they work, if they've gathered in a large gathering within the last month, if they traveled out of the state, all of these things that come together to allow us to collect all of the data that we need.
Awesome. And then you also navigate them to getting some of the care they might need with everything kind of being shut down. A lot of people need resources still that we're able to provide them. Stephanie, tell us, what is the main thing you've learned about this virus? It's kind of all new to us, but you've kind of been talking to these people one-on-one about their experience with it. You know, what would you say is most surprising or different aspect of this virus than other?
I guess mostly that our patients that have a lot of underlying health conditions or comorbidities seem to take a little bit longer to recover. Those are a little more, you have to really talk to them on almost a daily basis, just to check in on them. But our other patients that are positive that do not have those underlying conditions seem to have more mild symptoms or are recovering a lot quicker.
That makes sense for sure. What about you?
Kind of the same thing. And it's so weird because when we first started, you know, it was cough, fever, shortness of breath. And as we talked to people, we was like, oh, well, they're having change in taste, change in smell, maybe some nausea, maybe some vomiting, maybe some fatigue, you know. And it just, each patient may have about the same symptoms, but it's all very individualized, you know.
Tell us about something, speaking of individualized, something maybe that in your journey, one you came across something that surprised you, or maybe you learned something you did unusual or different.
So I guess something that kind of surprised me was, you know, how one person can just set off like almost like a domino effect. You know, one person can shed this virus to, you know, 5 people, and then those people spread it to another 5, and so on and so forth. So we're so interconnected as humans, and that kind of was eye-opening.
Right, that's why it's so important to have that communication piece, to educate them and to talk about, you know, how they could be protecting themselves and protecting others. You know, what would you say is, you know, your main advice to the public as we start to reopening all the businesses and restaurants and starting to get together more? You know, what would you say to kind of warn people a little bit?
I would say that just because things are starting to open up, I wouldn't just let my guard down. We want everyone to continue their hygiene, hand hygiene, distancing, things like that, just because, you know, we don't want everybody just to think, oh, we can just go about our own business and do what we want. That's not the case. We just want really everyone to keep in mind, to keep this hygiene.
Exactly, because you found, you know, this isn't just affecting our elderly population with comorbidities. It is the young people who are in their, you know, 20s, 30s who will be going out and trying to get out there because they aren't, you know, sick or anything.
Anybody
like
can
that.
get it.
Yes.
Exactly. So
We've seen a lot of younger people getting it lately too, right?
Yes,
You shared that
we
with me.
have.
sure. So no one's safe. Of course, you may not have a, you know, a terrible outcome from it, but it's definitely going to still keep spreading. That's for sure.
So I want to bring it back to Heather for a minute and kind of recap the experience. You guys are awesome in what you've done. I have read every single note that you've done and looked at all of the different dots you've connected. And as you said, it's been amazing learning how one person can be connected to 5 or 6, also I think they call it a vector. And it's just been really phenomenal what you've done. And most importantly, what I feel like is by calling them and doing the contact tracing, original reason we set out to do this is you kept other family members and friends of these people from getting it. And I think that another title you guys need is Curve Busters, because Michelle's
Amen.
graph shows that we peaked before the rest of Mississippi from the track we were on, and over 300 less cases probably, and I guarantee you that that has a lot to do with you guys doing the tracing and navigating and being there for the people. So thanks for being a curve buster on top of everything else. But Heather, I guess kind of from your perspective, from this experience, what do you want to share about it, and what might we do? We thought about doing a paper on it or something. Tell us a bit about kind of bring it home for us.
So we hope to do a research paper, or what I call a playbook. Granted, we had a good plan going in, but you never know until you get in the game, right?
Right.
What you need to do.
What are you going to learn?
So hopefully this never happens again, or at least especially to this scale. But I think we can use some of the things that we've learned and apply it in other situations. So a playbook and a research paper. We hope to put it all together.
I'm very excited about the research paper. As you know,
Absolutely.
we talk about that all the
Absolutely.
time. I am. It's going to be great. They're partnered with some academics to do this, because we've learned so much from over 200 cases, what we've learned. And again, the thing that I'm most proud of you guys doing is I feel like you have literally hit our mission of improving health and saving lives by doing what you do. And on Nurses Day, I think it's very fitting that we would talk about this. And one thing that I've learned through this from what you've put together is, you know, we've got this whole misnomer, safer at home versus safer at work. You're safer at home if you're not hugging a bunch of people having a party.
Right.
You know, but that's the issue, is a lot of your contact tracing has shown that people get this. A lot of people get it from family and
Close
friends that they
friends.
know, from hugging each other. And so We've got, as Darylyn and Sonia reminded me, we've got people that are doing little graduation parties. I get that. It's a tough thing to not be able to go through a regular graduation ceremony. But if you have one, don't hug or give air hugs or fist bumps. The same thing with Mother's Day coming up. Don't have a bunch of people over to see Mother because, you know, you can see her, but don't hug her. Give air hugs this year for Mother's Day, because that is where we see that most of it comes is from family gatherings, social gatherings.
Absolutely.
So you can be out and you can be around people, but don't hug them.
Someone you're in close contact with for an extended
Yep.
period of time usually.
Exactly.
Yes, thank you guys so much for not only just collecting this data to make sure that we can, you know, like Heather said, keep this from happening hopefully again, or know what to do if it does, but also for providing the comfort to these people. They kind of held their hand during the uncertain times, so we really appreciate that. And you know, just keep washing your hands, don't touch your face,
Don't touch your face.
no hugging, you'll be fine.
No hugging. Air hugs. Air fist bumps. Stay Singing River strong. Oh, and most importantly, today is Nurses Day. We love our nurses. You guys really are heroes, and we appreciate you so much. Happy Nurses Day.